Right, good evening. It's great to be back and being able to chat to you guys at the third and final part of a series on rhinoplasty. I've got to be careful, I'm just in the vehicle at the moment. I had to get away from the hospital. So this is the third part. The first part was talking about all the pre-surgery stuff, going through what do you expect before an operation and all the workup, etc. on that. The second part was chatting about the actual surgery, and I went through the two different cases. I'm obviously going to show you that right at the end, but for now I just want to talk to you what do you expect in terms of a couple of few things right after the operations. I'm going to look at it in two parts. I want to look at it in the first week and then the first year. So what normally happens is patients will be sent home after operation. Occasionally, if we're operating in the afternoon, you may have to sleep over, and patients who had a rib graft would most likely also sleep over and get sent home the next day. But most of the time, a rhinoplasty is a same-day procedure, so you can be going home on the same day. The first week going to be quite uncomfortable. We'll speak about the normal things, and then we'll speak about possible complications. So when I say you're going to be uncomfortable, you should not be in any pain. You're going to be, your nose will be packed. You'll have two silicone tubes on either nostril through which you can breathe, but you're going to be congested with that. You'll have a plaster over the nose with a splint on top of that, and there'll be a few stitches right at the bottom of the nose. What's really important is that you put the antibiotic ointment on underneath. We generally do not discharge on antibiotics because we'd rather use the antibiotics if something goes wrong at a later stage. When you go home, you'll get a kit with a whole lot of things. One of those is to stop a little bit of bleeding. It's completely normal to have a little bit of bleeding initially. Major bleeding obviously is not normal. You should not be any pain. Pain is a warning sign, and severe bleeding are warning signs for us. And I'll speak about the complications later. In that first week, you obviously don't want to do any exercise. You want to really just have some time out. Be relaxed at home. Spend a bit of time on the social media if you want to, read a book, etc. You don't want to strain yourself in any way because it can cause bleeding. I would advise sleeping with a cover over the pillow for the first night or two in case there's some blood, which is normal, bit of secretions. As you obviously remember, there's the anesthetics that has to work out as well. That is, you might have been asleep for up to 3 hours in an operation, so it takes some time to get over that. By the way, if you have any questions, please just post them as I speak. I see there are quite a few people who've logged on now, so you're welcome to ask me any questions you may have. Okay, so then after 1 week is when I will see you again, and that's when it's a great meeting because people are feeling tired. They've had a week of having their noses full of blocked up, and they want to now have the plasters off and stuff. So we take out the stitches, we take out the silicone tubes on the inside, and then obviously the big reveal is once we've taken the plaster off and I show the patient what they look like. And it's to me, it's just such a awesome time. We get quite emotional when you realize just what you've done for somebody, and that some people have been living it for their whole lives. And I'm always kind of touched by how, what a big thing it is for a lot of people that they've been living with it, but until it's actually done and the joy of having it done, it's great. So obviously there's some people who are quite shocked because initially you're going to be swollen. Okay, you may bruise. Some people bruise really badly. Some people don't bruise at all. And so the important things that are initially going to happen is this face is going to look puffy, the nose. The second thing is that the skin, because you've had a plaster over the skin for the last 7 days, you may have small pustules, etc. And it'll be kind of sticky and discolored. That's your initial reaction, and people feel very like, oh, can I blow my nose? Yes, you can blow your nose. Obviously not aggressively, but in that first week now, so we've had our first week, we've taken the plasters off, then you can go ahead, you can start cleaning your nose nicely, carry on with the antibiotic ointment that you've got to put in the nose. By now we'll start giving you some saline douche to wash out the nose, and maybe some intranasal steroids to help with the swelling. In that first week, you're going to find the edema settles tremendously. And one of those things to do is to learn how to tape the nose. So I'll put a video up later about taping the nose. But basically, if you feel the nasal skin, the top half of the nose has got the very thin skin, and this settles very quickly. But the bottom part of the nose is quite thick and hard. And this is when it takes a longer time for the edema to settle in the bottom half of the nose. Also, if we've done a hump reduction where people will find after 2 or 3 weeks that they say, hey, my hump is back. And it's not back. It's a normal reaction for what we call callus formation around the bone when it regrows. So there's going to be some swelling, and that will settle again a few weeks later. So in the first week, you'll find puffiness. You'll find a bit of tenderness. You'll find the tip feels quite a lot harder. Okay? And it feels a little bit numb at the start. So we kind of progressing, going through that first week into the second week. From now on, you'll see exponentially it starts getting better. And it's only after 1 year that we finally get to the end results. And what we'll find after a year is that the feeling would have returned to the tip. The swelling should have gone completely. But there's going to be a slight stiffness to the tip. You saw on the photos I showed of the various grafts I put in. So that does take some time to settle. What then happens is the final outcome, and that's quite difficult because I will try my absolute best in surgery, but a patient's healing and the patient's the way that the body's going to restore itself can have an effect. And around about between 5 and 8% of patients might have to go back for a secondary procedure, and that's very minimal. For example, it might be that the one nostril looks a little bit higher than the other nostril. So once we've straightened out the nose, that suddenly stands out. So, or someone feels that maybe the hump's a little bit too high and we need to go and shave off a small spicule of bone on one side. I would not want to do a secondary rhinoplasty at least a year into the surgery, so that someone has completely settled. They've gotten used to their nose. They know what it's like. And it's really important to get to that point. So the first 10 minutes now is just talking about completely what to expect going through up to a year. I want to spend a little bit of time before I show you the before and after photos of the two patients of what some of the complications are, because you need to be aware that things can go wrong in operations. Okay, so in terms of what can go wrong, there's anesthetic things that can go wrong and there's surgical things that can go wrong. So from an anesthetic side of things, if you've been under anesthesia for a couple of hours, you're going to be washed out for a few days. Occasionally people may even get some type of a lung infection. I mean, it's very important for me to say these things because people are like, oh, how can we go ahead with the operation? It's essential, things can go wrong. I went through quite a dramatic experience about 2 years ago where I had a little mole cut out of my head, and I had a near-death experience on the ICU for 16 days. So I take it very seriously that we need to be aware that things can go wrong. On a surgical side of things, again, I'm going to look at it kind of in the first part and then the last part. So in the first part, what are some of the complications going to happen is bleeding is one of the big complications that can happen. And I'm not talking about just a little bit of dribbling and stuff. It's a proper bleed. So what happens is either there's been some work done on some of the sinuses, or a vessel is bleeding in the septum. The big concern really is not so much that we're going to lose so much blood. It's obviously an uncomfortable thing for a patient, but we can get a hematoma. So a hematoma is when the blood forms like a big clot and it hasn't disappeared. And that can be anywhere around the nose, but it can also happen in the septum. Now, a septal hematoma is a concern because what it can lead to is the second main complication, that's infection. Because you can imagine that if you've got a lot of blood, the bacteria that can grow in that medium, it's a nice medium for them. We don't want that. So I'm quite aggressive. If there's any chances of septal hematoma, that I'll take that patient back to theatre urgently and go and drain that. And it does happen. Those things happen. An infection is when you're going to start feeling things could be going wrong. So a number of things need to be looked at there. A patient can generally starting to feel unwell. Your heart rate will start going up. Your temperature will start going up as you start fighting infection. Remember, it's normal after quite a long anesthesia that the way the body reacts is you can have a higher temperature, but an abnormally high temperature can be an indication of infection. We would then take routine bloods, we'd examine you, we'd make sure that you are not infective. And if you're infective, that's when we start with antibiotics. I'm very sensitive to want to use antibiotics if there's an indication for it later. As I said earlier, we don't generally discharge you on antibiotics because the problem is if we start you on antibiotics and send you home and you get sick, then you may have resistance. So that's a more dangerous situation. There's a very small handful of patients who would complain of the third complication, that is severe pain. It could be that could be from the bones that were broken, if bones were broken in the nose. It could be a discomfort from having the silicone plugs in the nose, and then you could even get an associated sinusitis with that. Another thing people will feel is that they'll feel there's like a numbness that could be in the front part of the front four teeth, because when we remove the very deviated septum that you can find in the inside of the nose, the little nerve that separates the front four teeth is a slightly different nerve to the rest of the palate. So the front part, people can feel a little bit funny. Occasionally, we'd also be working on, if someone say, for example, their teeth are showing a lot and we have to release the muscle so that when they're smiling, it comes up like this, it will drop down. So they can complain a little bit about pain like that. But really, in the main things that could happen in that first week is bleeding and infection and pain. I'm repeating it again, that people often, we will prescribe mild painkillers, but by far the majority of our patients don't even take that. And that's one of the nice things about the rhinoplasty is, yes, visually it appears that it's quite a serious looking operation, but fortunately afterwards it should not be very painful. So then, just moving before, I'm going to show you the pictures just now of the before and after photos, but I wanted to just touch base on long-term complications. So the long-term complications, not necessarily anesthetic, that's all surgical things, and that is both on a functional and on a cosmetic side of things. So remember, rhinoplasty is always functional and cosmetic. So on the functional side of things, if potentially the septum has moved or there's been a problem with a nasal valve, patients can come back and say, hey doc, this isn't good enough. For example, I had a patient, a rugby player, whose nose was literally on the side of his face, and I did a primary rhinoplasty on him, a rib harvest, repaired it for him and brought it right back almost to the middle, but it still wasn't quite right. So after 18 months we took him back and we completely straightened his nose. Cosmetically, a few things can go wrong. There's deviations that can take place, so it's either skew, or there can be complaints about either too much of a hump or too little of a hump, or potentially the projection can be too far back or too far forward, and sometimes there can be over or under rotation of the nose. So from the side, it's either up or down from this piggy nose. Another thing people can sometimes complain of is that the columella strut graft can irritate them a bit if it sits right on the nasal spine over here. So those are things that we can really think very carefully about. I think it's important to say that you should not be wanting to do a rhinoplasty and at the back of your mind think, oh, I might want to fix it if things don't go wrong. I think it's really important to try and get it right the first time. So let me show you these two photographs now of the before and after. The first one is of the lady we did, and this is very much graphically the surgery on table results. Okay, the second one was of the guy who I'm going to show you a few months after the surgery. So I'm just going to flip the camera around and show you there. Okay, I apologize that I have to be in the vehicle doing this. I've just got to find a spot that's not near the COVID virus. Okay, so let's just have a look here. This is on the table. As you can see, there's quite a big hump over here that we have now taken down tremendously. Okay, We've also lifted up the tip and given her a super tip break point right over there. Okay. I don't have the photograph here for the inferior worm's eye view, but her nose was very far tilted over to her left, which we've brought back as well. So I will be posting her 4-month results when I get back over COVID. So this is the lady. I'm just going to try and show you quickly what the male result was like. Okay, so there we go. So I'm very happy with this one as well. We can see his before operation, okay? And this is 4 months after the operation. So his entire face looks completely different. So we've managed to this big dorsal hump. We've removed that. What appeared to be, and this is what's quite interesting. If you look at this now, you could see a lot of his nostril over here. You can see very little of the nostril over there. So we've managed to improve the nostril shape here quite drastically. What we've also done is that if you look at kind of the way where you'd say the tip of the nose is, it's almost like hooked down here compared to being a much more straighter profile in that aspect. If you remember, he had these massive septal spurs and deviated septum. So he's absolutely delighted that he can breathe better again. But what I want to show you here is just if you look at this whole profile of his face, just kind of take a step back from the nose and look at the face, where the face almost looks a bit more curved here because of what the nose does to it. At this point, it looks a lot straighter. So the take-home point with this one is to show that you can have a dramatic effect on someone's facial profile by changing the shape of their nose. And so I've done nothing to his chin. I haven't augmented his chin in any way. I've done nothing to his lip, done nothing to his forehead. I've only worked on the nose, and you see how drastically it's changed everything there. Okay. So this actually brings us to the conclusion of these three series of 3 about 2 cases I wanted to share with you. And I want to conclude by firstly saying thank you very much for tuning in and watching this thing and asking various questions, etc. I really hope it's been informative. My entire motivation behind this has been to try and help patients to have a slightly better understanding of what a rhinoplasty is, and understanding that there's a lot of work that gets done beforehand, there's a lot of work gets done during, and then there's a lot of work that gets done afterwards. So I'd really encourage you to reach out to your rhinoplasty surgeon that you're considering to go to. Within South Africa, I'd encourage you to visit our Rhinoplasty Society website. That's the rhinoplastysociety.co.za website. All our surgeons are on there. We've got surgeons around the country. And the guys who are part of our society are guys who are really passionate about rhinoplasty. They don't just do it as a hobby. It's their profession. They love it. They go on overseas courses. They really spend a lot of time doing their homework. And I would encourage you to look up those guys. They're the guys who know what they're doing, and ask them the questions. I hope out of these videos you've been able to understand a lot more about why you should have a rhinoplasty, what the functional side of rhinoplasty is, what's the cosmetic side of rhinoplasty, what are those specific things you want done to your nose, being able to ask the surgeon, are they happy to do that? I think it's important that the surgeon and you are on the same page, that you can, what he's expecting or she's expecting to do for you and what your expectations are the same. If that's not the right person, then I would encourage you to find somebody else, because you need to understand that you need to trust your surgeon, because if things are, you're going to see him or her many times during the time of your procedure and afterwards. And if things go wrong, you need to know that that person's got your back. So don't necessarily go doctor shopping for the cheapest guy or the most expensive guy or etc. It's really important that you nurture that relationship with your surgeon. And there are great surgeons around the country. I can highly vouch for many of the guys around here. And so think very carefully about if you want to have a rhinoplasty. And I'm going to hopefully do, once we have finished with the coronavirus, we'll try and do some more live surgeries potentially, and up our game a little bit. Yesterday's was just done off the phone. but we'll try and bring in a few more things, and we're going to put a lot more stuff on our Rhinoplasty Society website. So yeah, I hope you have a great rest of your evening, and please be safe with the coronavirus. It's tragic to hear that we've had 2 people dying in our country already, and if you care at all, please look after yourself and social distance. We can't infect each other. Just listen to what's happening and be careful. Okay, so over and out, and have a nice evening.